Mariama Jones was 19 weeks pregnant until she wasn't. She was one of thousands of pregnant women in Africa to fall victim to malaria. She made it out alive, but her baby didn't. Why? Because she didn't know that as a pregnant woman, she had a higher susceptibility to malaria, and she failed to take the preventative actions that she needed to take. This misunderstanding cost her her baby's life. To prevent this from happening in the future, we present to you our plan to mitigate malaria in Bauchi State, Nigeria.
So the purpose of our public health campaign is to raise awareness about malaria in Bauchi State, Nigeria, and to provide an educational resource that will encourage people to take some preventative measures. We believe that given proper education, people will be able to take responsibility for their own health and seek treatment when needed.
This is our team that is presenting our public health campaign. My name is Sarah. I'm a rising junior and I live in Yorba Linda, California, and I go to Crean Lutheran High School.
Hi, my name is Nicole. I'm a rising junior and I go to the Kincaid School in Houston, Texas.
My name's Jada. I am a rising senior. I go to Marriottsville High School in Marriottsville, Maryland, and I live in Clarksburg, Maryland.
Hi everyone, my name is Afomia Bishaw, and I'm a rising senior at Bishop McNamara High School in Forestville, Maryland, and I live in PG County, Maryland.
Hi, my name is Isabella. I'm a rising junior and I go to school at Kelly Catholic High School in Beaumont, Texas. So this is a map that we wanted to show. It shows the pinpoints of where we live, and we just wanted to show this that because of the pandemic, unfortunately, we were not able to do this together, but even though that happened, we still managed to collaborate on this, and we have also developed really good friendships in the process.
So you may be asking, what is malaria? Malaria is a disease caused by a parasite that is solely transmitted through mosquito bites. It causes an interruption in red blood cell activity as the parasite causes red blood cells to rupture and hemoglobin levels to decrease. As a result of this, hemoglobin levels decrease and anemia can occur, which leads to weakness and fatigue. The malaria itself can lead to fatigue as well and intermittent fever. All of these have a negative impact on the patient's health, even if it's an uncomplicated case. However, if it is complicated, it can cause seizures, comas, and even death. So 97% of the population is at risk, so it's extremely widespread. And there are about 100 million cases a year and 300,000 deaths, according to the United States Embassy in Nigeria.
Malaria has and continues to pose a major health concern in Nigeria. In 2017, for example, the WHO declared malaria the fourth leading cause of death in Nigeria. This is not surprising, though, considering that an average of 93% of all cases are concentrated in sub-Saharan Africa, and Nigeria alone accounts for 24% of malaria-related deaths in the entire world. Now, the WHO has made efforts to provide malaria treatment in sub-Saharan countries like Nigeria, which was effective for a while, but ever since 2014, the efforts have failed to show significant reduction in malaria cases. But why is this happening? Malaria should not be taking such a high death toll anywhere, because if treated properly, it's a curable disease, and with proper prevention tactics, many of the people dying from it shouldn't have gotten it in the first place. A major issue is that people of all ages, young and old, are unaware of the ABCDs of malaria prevention: awareness of risk and symptoms, tactics for bite prevention, checking to see if you need treatment, and when to get a diagnosis. This lack of knowledge has some serious consequences.
So our solution regarding the prevalence of malaria in Bauchi State, Nigeria is through educating both adults and children on the disease. We strongly believe that raising awareness through interactive flyers will encourage people to take preventative measures. They will learn about the disease and they will know the warning signs, how to prevent it, and treat it if need be. Education is the first step in the process to slow the spread of malaria in Bauchi State. With our public health campaign, people who have already contracted malaria will also be able to get the information they need, and they will be more willing to go to the doctor and get treatment. Likewise, people who have not contracted it will have the knowledge to prevent it before they can get it. With this information, people will know how to take preventative measures into their own hands. For example, they will know to implement mosquito nets, bug spray, and long sleeves into their daily lives.
Mariana Johnson's child was just one of the many examples of children who die every day from malaria. About one child dies every 30 seconds. So this is why we targeted one of our flyers to children. We want to make this accessible to children in schools, and we used a coloring page tactic in order to reach them. So on the coloring page, you can see that we're showing what children should not do, and then we are showing preventative measures, and then we are showing what a child should do if they do contract malaria.
And this flyer focuses on mostly the teenagers and adults. Unlike the one that was for children, this gives more information and it also goes a little bit more in depth to help prevent malaria and how to take action in your community to help others.
And here we have a preview of a letter to officials to Bauchi State, strongly urging them to directly speak to their citizens and to tell them how they can take measures to treat and prevent malaria, like encouraging them to maintain a dry, hygienic environment and using mosquito nets and repellent, and how to determine if they're at a higher risk or not. It also encourages them to ensure that doctors in the community take thorough and careful care of malaria patients and to show them exactly how to respond to each and every situation. This will help mitigate the deaths.
Our public health campaign has many advantages. One of the most important ones is that it is specific to Northern Nigerian culture. For example, the location. There are many Muslims in Bauchi State, so we are bringing our flyers to mosques, which Muslims pray at 5 times a day. We are also bringing it to high-density places, such as bus stops and markets. Furthermore, we are bringing them to hospital fronts because if someone contracts malaria, they always bring their friends, their family with them. So if they see the flyers, they will be able to be educated, and this would help them in the long run. Our public health campaign addresses multiple demographics. So we have the flyer addressed to children, and then we have the flyer addressed to a larger audience. Furthermore, education creates a long-term effect. For example, if we were to give people in Bauchi State vaccines or nets that would help them prevent malaria, this might be very helpful in the short term. However, education is the most important to create a long-term effect. This is also easily communicable information. When someone receives a flyer, they could give it to another person who can give it to another person, and they can also spread it with word of mouth. And there's also a very low cost to distribute these flyers.
And now it is time to discuss the disadvantages to our solution. And there will be constraints when it comes to spreading the word with our flyers about taking action on malaria, because most people may not speak the English language. But with the graphics and pictures provided on our flyers, we hope people will understand what to do and how to prevent malaria and help others as well. Next, there will be some required lifestyle changes, such as maybe getting an insecticide net, wearing long tops, bottoms to protect your arms and legs, and traveling to doctors during dry season, and so much more. Another thing comes to cultural concerns, because Nigeria has a bunch of tribes, and let's say, for example, one person from one tribe needs to go get checked up or to get tested for malaria, but the place to get checked up is probably in another tribe area, and that can cause some concerns. And lastly, with limited supply, we will be sending our flyers to places where lots of people tend to gather, such as mosques, markets, and so many other places, so we can get the word out there to educate people and help others with malaria.
The first step to our plan is to finalize the materials that you saw a couple of slides back. Once they're completely finished, they will be printed in the Leadership Initiative offices in Nigeria. This ensures that printing, because it is the only significant cost, is relatively low. We then plan to distribute the flyers in strategic locations. The flyers targeting children will be handed out at schools in Bauchi State, where they can do the interactive lessons with supplies that are already available, like crayons or markers. The second flyers, which are geared towards adults, will be handed out in mosques or the marketplace, since they're locations with lots of foot traffic. In order to monitor the success of the project, we can keep an eye on the number of malaria cases through data provided by leadership initiatives.
To fund our public health campaign, we are requesting $200. We will use $150 to pay for the children's coloring pages, and then we will be using the rest of the money to purchase the flyers for the adults and teens.
And last but not least, please feel free to contact us with any inquiries, questions, or anything with any of these numbers or emails that are provided on this screen. We really would like to thank you for joining us for our mission to mitigate malaria in Bauchi State, Nigeria. Thank you for listening, judges. Thank you.
Great job, guys. I'm going to bring in our judges. Stop sharing your screen, and we will love to hear what they have to say. Panelist. Okay. So first we're going to go with Dr. Garba. Dr. Garba is a doctor in Nigeria. For people watching this video, she has helped run multiple public health campaigns and saved thousands of lives over her years working in the Nigerian community across the entire nation. Dr. Garba, please tell us your thoughts.
Thank you very much, Scrubs A, for this wonderful, wonderful presentation. Okay, Jada, the first story you told, your composure, the story, everything was amazing. Okay, nice introduction. You guys took the time to all introduce yourselves. You know, it was really wonderful. Okay, Nicole, you had really nice message to send across, but your eye contact was missing. You need more eye contacts to convince, you know, whoever you want to convince that this is what you really want. You have worked really hard for it. So it was really good. Just next time, more eye contact, okay? Wonderful presentation regarding the ABCs of the malaria prevention. Amazing, you know, you guys have really worked hard. This has proven that you have worked really hard and you know exactly what you're doing. The flyer, the children's flyer was amazing. Children are going to be engaged with the flyers, and the location, the targets locations also super, okay, super, because those are the places where most people gather. Even if one person does not get the flyer, at least even from word of mouth, you'll be able to tell the next person. In general, very, very amazing. Okay, it's amazing. Excellent work, guys. Thank you so much. You did well. Congrats.
Awesome. Thank you, Doctor, very, very, very much. Next, we have Nancy Allen, who's the Executive Director for the National Consortium for Health Science Education. They work in all 50 states. It's a nonprofit, and what they're doing is creating leaders in secondary, post-secondary, and adult career education, technical education, sorry, Nancy. But basically, she's making leaders and teachers and inspiring high school students across the United States to take that next step into careers in medicine. And I know it means a lot to her to work with you guys today. So Nancy, I would be honored to have your thoughts on these amazing individuals.
Okay, congratulations, Scrubs A. You did a great job. Your slides were very professional. I really liked that map where you were able to pinpoint where you all live. I thought that you know, I just like the fact that the world is small because of technology, and that you were able to mention the pandemic, and that it had not interfered with your ability to work as a team. So I thought I liked that visual very, very much. And you were kind of covering from California to Texas, and then over on the east as well. I had not seen in any other presentation the interactive flyer that also Dr. Aisha mentioned that too, the children's flyer. I think I give you 5 stars for that. That was great. The letter to the state officials, that was very creative. And also the multicultural approach, so the places you were going to be, trying to meet different cultures. I picked up on that as well. So great job. You all have great, your slides indicate that you have some technology expertise, and so congratulations. And the research and your work was very evident throughout your presentation. Thank you.
Got my notes here. You guys cared about the subject matter. You pulled it together as a team, and even when something weird happened, I know an alarm went off, you guys just kept pushing on through. That's the mark of a team who can't get shaken. And I really, really appreciated that. You guys were unflinching. You knew your subject matter. You got it to the audience, and you hit all the right notes. So I'm definitely going to be recommending this solution to be funded. Thank you guys for working so hard this week. To college admissions officers watching this video, information about each student will be at the bottom of the video with links to their individualized websites. I can't encourage you enough to go there. You can actually see videos of them diagnosing patients yesterday. And once their diagnosis was accurate, from a medical doctor looking it over, we actually paid for that patient's medical treatment to save a life. If you have any questions about any of these students, please call our office number, which is also at the bottom of the video. Thank you guys so much, and we're going to stop the recording now.